Good morning, Your Excellencies, Head of States and Government. I speak on behalf of 14 member states of CARICOM. This high-level meeting brings us together for the second time to express our global solidarity with the fight against tuberculosis, this time through advancing science, finance, innovation, and their benefits. Mr. President, CARICOM is concerned that 30 years after the World Health Organization declared tuberculosis a global health emergency, the tuberculosis epidemic still remains a challenge in all regions of the world, especially in developing countries. We are proud that the CARICOM region has made significant gains in the management of the tuberculosis epidemic over the years. Despite this progress, we know that in the Caribbean, tuberculosis continues to affect people in vulnerable situations, including those living in poverty, those with HIV, as well as migrants and refugees. We also are concerned that people living with and at risk of non-communicable diseases, especially diabetes, are particularly affected. Therefore, we cannot risk leaving anyone behind. We must invest in more contemporary prevention services, especially for children. In CARICOM countries, the TB vaccine license in our region has been incorporated into the routine immunization programs As of 2021, our vaccine coverage is 93%. However, we acknowledge that more needs to be done. We must scale up screening and diagnostic services. The tuberculosis epidemic, driven by social and economic determinants, has been a major cause of morbidity and mortality in the developing world. We are saddened that although TB is curable and preventable, a total of 1.6 million people died from tuberculosis in 2021, and an estimated 10.6 million people fell ill with tuberculosis. While we commend the development of new tests, drugs, and regimens, including those with less pill burden and shorter duration regimens for drug-resistant TB, we note that these are not universally available. World Health Organization reported that only about 1 in 3 people with drug-resistant TB accessed treatment in 2021. This underscores the urgency of ensuring equitable, timely, and affordable access to prevention, testing, treatment, and care. Profound financial hardships combined with catastrophic out-of-pocket expenses for people accessing tuberculosis services, especially early and accurate diagnosis, as well as lengthy treatment regimens, still pose the greatest threat to ending the epidemic. The time is now for us to collectively and genuinely commit to increase equitable access to tuberculosis prevention, testing, treatment, and care services. However, CARICOM reminds that these commitments cannot be realized without upholding the right to use flexibilities provided for in the TRIPS agreement, as well as by ensuring transparency of pricing of health products. The multi-drug resistant tuberculosis remains a public health crisis globally. We seriously regret that no new vaccines for prevention of all forms of TB have been licensed over 100 years. CARICOM supports the quest for a new vaccine or any scientific breakthrough for vaccines that will be effective before and after exposure of TB. The COVID-19 pandemic has revealed that we have more than sufficient technology and resources to develop vaccines in a very quick time. Everyone, everywhere must be able to enjoy the benefits of scientific progress. Furthermore, CARICOM reinforces the need to support developing countries' research, development, and production capacities, especially through the transfer of technology. We also call for increased support to developing countries for building data capacity so that we can adequately fulfill our TB reporting requirements, especially as we recall the TB reporting services decreased drastically during the pandemic. Mr. President, the reality remains that many developing countries, including CARICOM states, do not have adequate financial and other resources to effectively bring an end to the tuberculosis epidemic. We therefore echo the calls for international cooperation, especially through official development and financial assistance. We are cognizant that we would need $13 billion annually for prevention, diagnosis, treatment, and care to achieve the goals we collectively set in 2018. We hope that this meeting will reinvigorate our efforts to attain this target. Mr. President, as a group of small island developing states where we are more susceptible to climate change and natural disasters, we are aware of the higher burden of tuberculosis in the aftermath of natural disasters. Therefore, we use this opportunity to champion calls for climate action and the need to integrate health in climate policies while ensuring that we also integrate climate action into our national health agenda. We therefore congratulate the World Health Organization and our regional health agency, the Caribbean Public Health Agency, for their excellent leadership in the fight against tuberculosis and their attempts to reinvigorate the research and innovation so that we can accelerate the fight against the epidemic. Mr. President, globally, solidarity is imperative and must be shown by all, not just through speeches at the meetings convened during the high-level week, but through international ambition. I conclude, CARICOM reiterates that we must act with urgency to advance science, finance, and innovation in order to ensure equitable access to prevention, testing, treatment, and care for everyone. Thank you very much.